What is a myeloma specialist?
So a myeloma specialist is a hematologist oncologist who primarily sees myeloma patients in the clinic. Let's say at least 100 or more per year. Additionally, he or she presumably attends myeloma conferences and may well be involved in myeloma research studies.
A multiple myeloma specialist is someone who treats myeloma exclusively. So this is someone who's treating probably hundreds of patients and who's been treating it for quite some time.
Why is it important to see a myeloma specialist?
It's important for patients to get a second opinion from these myeloma specialists. Treatment options vary. So that specialist becomes part of your medical team and is able to work with your local oncologist.
So you go to a local doctor, he sends you a local oncologist. A local oncologist sees maybe one, maybe two myeloma patients in a year's time. And as a result, he really doesn't have the expertise. For example, if you go to a place like MD Anderson, Dana-Farber, Levine Cancer Institute, or UAMS, what you're going to find is they have thousands of patients that they're dealing with. And anything that can go wrong, they've seen, and they've been able to resolve those issues. So their performance, which I've found based on some of the information that I've learned, is that in the first 2 years, about 25% of patients don't survive. But if you go to one of these larger institutions, that's down to 5 or 10%, or twice as good, or 4 times as good survival rate in early diagnosed patients.
It's important to use a myeloma specialist. The University of North Carolina did a study that showed that if you see a myeloma specialist in the first year of your treatment, you will actually live 39% longer. The Mayo Clinic also did a study. They broke the facilities into quartiles of how many patients they treated, and they found that you could double the survival if you went to an academic center that treated more myeloma patients. So it's really, really critical that you have a myeloma specialist on your team. They are typically also doing academic research. They're attending meetings like the American Society of Hematology, which is the ASH meeting, the big hematology meeting. One of the myeloma specialists, Dr. Ola Landgren, said, in myeloma, you used to be able to go do updates every 2 years or something at important meetings. He said that's no longer the case, and he said even 6-month increments are not enough. So they're going to ASCO, they're going to ASH, they're going to European meetings. There are probably over 10 meetings that could be attended for myeloma for the experts to go to on an annual basis to keep up with the disease. And they do that, and they are treating their patients too. So they're seeing this nice balance of what's actually happening in the clinic and what's happening in academic research, and they're putting that together for their patients. It's very common for a myeloma patient to go to an academic center, especially when they're making a decision, and get the testing, the deeper dive testing, especially on genetics or some of those types of reports that need to be run so that patients have all the information that they need to help you make treatment decisions.
I think every patient should have a myeloma specialist to interpret the data and to carry out the monitoring and to order the tests. I think it's important that that's done by a myeloma specialist who can give the optimum advice. I don't think all patients should be with a myeloma specialist all of the time, but you need a myeloma specialist on your team.
How do I find a myeloma specialist?
There are a number of ways to find specialists. Myeloma Crowd has a wonderful listing of specialists by geography. The International Myeloma Foundation, MMRF, LLS, you can call any one of those and they can provide you with myeloma specialists in your area. Patient advocates like myself can certainly let you know of myeloma specialists that are available. The good news today, unlike when I was diagnosed 24 years ago, is that there seems to be myeloma specialists available in any large city. And I think it's really important for patients to take advantage of that so as to be able to make that myeloma specialist part of their treatment team.
In HealthTree, we also have a directory of myeloma specialists, so you can see where they are and who's at which facility by region. When you enter your zip code in HealthTree, it'll show you the closest myeloma academic center near you, so you can see which doctors are near you. But sometimes you might have relatives that live across the country or live in the next state that you could go to, and you could find a specialist that's close to you, and then you can go home and you can get your care locally at home as well. So that's a nice balance that a lot of patients use.
I was diagnosed with multiple myeloma in 2016, and I started reading a lot about it and studying and trying to learn as much as I could. And one of the things that I learned right away was the recommendation was find a myeloma specialist, and that seemed to be the common theme that I ran across, all the time, was you got to get a specialist, you got to get a specialist. Well, in searching for a specialist, the nearest one I think was Houston, and just the geographical challenge and travel challenge and all that. I was in remission at the time. I'd gone through the stem cell transplant, was on the maintenance therapy and all that. But I knew that eventually I needed to really look at finding a specialist, because this disease doesn't just go away. It was earlier this year I learned that the Myeloma Crowd sponsored and developed the HealthTree website, where myeloma patients can go in there and go into the website and put in their information, which is what I did. And the same message came up in that registering in that website was, you'll do better if you have a specialist. And oh, by the way, here's some choices. And one of those choices was here in Austin. Dr. Mitsui had recently relocated here to Austin, and it was just like, spot on. It was perfect timing. The man was here in Austin, and I didn't have to go through the challenges of, travel and any of that. And I'm just so thankful that it worked out that way. And since, I've discovered Dr. Mitsui and, connected and have had a few appointments with him, it couldn't have worked out any better. So it's a great thing.
To find a myeloma specialist, go to the Get Myeloma Help tile in HealthTree and click Find a Myeloma Expert. Here you'll see a full directory of all the myeloma specialists in the United States by region and facility, with information about how long they've treated myeloma and how many patients they see per year.